Since age 13, Henry has been battling anorexia nervosa coupled with borderline personality disorder. Evelyn struggles with schizophrenia, auditory hallucinations, paranoia. We have her on a new antipsychotic, hoping that'll curb her violent tendencies. Patients might be here anywhere from 6 weeks to 6 months.
You're not listening! You don't belong here. Get out! Get out!
That's enough, Tom. Why don't we go work on your art project?
Who are you?
I'm Dr. Reese. I'm visiting from Chicago Med.
He's right. I don't belong here. All the doctors think I'm crazy, but I'm not.
Dr. Reese, we're moving on.
She's the worst.
Hey, just so you know, crazy is a word I never use.
Suicide attempt. 15-year-old female from County Psych. She swallowed bleach, sodium hydroxide, and some sort of rust remover.
Hydrofluoric acid. Okay, call toxicology, get an NG tube in her, push an amp with calcium gluconate, and hang a magnesium drip. Watch for VTAC. You get a psych consult.
Got it. You have to get Dr. Reese for me. I need to talk to her. I wasn't trying to commit suicide. I was trying to see you.
Do you believe it's okay to hurt yourself?
How else could I get to you? It's not like I can ask for a phone call.
Nancy, you could have seriously hurt or even killed yourself.
You have to help me get out of there. They locked me up after I got in a fight with my mom. But she's bipolar, has been for years.
Hey, I'm sorry, but I'm not your psychiatrist.
My mom came at me with a hammer while I was sleeping. I was trying to defend myself. That doesn't make me crazy.
No. If that were the situation, it would be reasonable to defend yourself.
See? You're the only one who said that. All the other doctors think I'm psychotic, but my mom's the one who's crazy.
Dr. Reese, can I speak to you for a second?
I'll be right back.
Could you fill me in? I understand that you ran into Nancy on rounds this morning?
Yes.
Could you say anything to make her think it was a good idea to come over here and see you?
All I said was crazy isn't a word I ever use.
Gotta be very careful the way we talk to younger psych patients. They're much more vulnerable to mixed messages. She seems to think that you're some sort of ally.
I am. Aren't we all?
To get her the right treatment, of course, but this is a young woman who purposefully drank extremely toxic chemicals. I mean, Nancy's been diagnosed with borderline personality disorder. She has severe bouts of manic depression.
Uncontrollable hysteria, paranoid delusions.
People who suffer from these disorders can be very persuasive, very manipulative, and a danger to themselves. So we have to be careful. We wouldn't want to put her in a position where she wanted to harm herself again.
Hey, Sarah. You got a second? I heard that most of the psych residents get therapy.
Yeah.
Have you tried it?
Uh-huh. I'm sorry. Can we talk later?
Sure. Yeah.
How's she doing?
Well, we flushed her pretty good. She'll be medically cleared soon, and we'll have to go back to the psych hospital. You buy her story?
I don't know. She's on a 6-month psych hold. Does she seem like she requires that much time locked up?
Don't ask me. Psych's way too spongy. In med school, my head shrink professor took us to the mall and asked us to point out people we thought were mentally ill. No one could agree. That is when I knew I wanted to be an ED doc. Much clearer business.
Yeah. I wish there was a way to evaluate Nancy like an ED doc.
Well, maybe there is. Like I tell my residents, always go back to the history.
Dr. Charles, do you have a minute?
I do.
In order to get a more complete history, I contacted the officer who arrested Nancy and her mother. He sent me his report. Said they often get called to Nancy's house on domestic disputes involving the mother. She's been in and out of jail for assault. In fact, she is at county right now. Please take a look.
This could just mean that, mental illness runs in Nancy's family, and she and her mom suffer from the same disorder.
Or it could mean that Nancy was wrongfully committed by an unstable mother. The one thing we know for sure, it was her mother's testimony that got Nancy committed, and her mother's an unreliable witness.
Sarah, they're telling me to get dressed. They're sending me back.
I know. I'm sorry.
Sarah, please, help me.
I tried. I did, but Dr. Baker has conservatorship over you. According to the courts, she has to be the one to change the diagnosis, and we couldn't change her mind. Hey, I'm not giving up, and you can't either. Stay strong. We'll figure something else out. Okay? Give me a second. Dr. Charles, I know I don't have any definitive proof, but she is sane. I know it. We can't let her go back.
Slow down, Dr. Reese.
Dr. Baker just doesn't want to admit that she misdiagnosed her.
You know what? I happen to agree with you. I'm filing an appeal.
You don't think she's mentally ill?
Can't be positive, but either way, she should not be locked up on a long-term hold based solely on her mother's testimony.
Need some help?
Treatment 1.
What happened?
Give me some pressure. Must have grabbed a scalpel from the cart. Tourniquet her arm, giving hemostat.
It's tied.
I'm not crazy, Sarah. I'm not.
It's my fault.
Why'd you say that?
I gave her false hope. I told her I believe she was stable when she clearly isn't.
Well, not sure I agree. I mean, just made her case a little tougher, but I'm still gonna file the appeal.
Why would you do that when she just tried to kill herself?
Losing hope is not a sign of mental illness. It's a sign of being human. I mean, the poor girl, she has a violent, unstable mother, and her fate is in the hands of a psychiatrist who doesn't believe a word she says. I mean, given those odds, I can absolutely understand why she'd fall into despair.
Daniel, you secured the gun?
Yes, ma'am.
Check him. Daniel, I'm here. Oh, God. It's okay. It's okay. Do you know who I am?
Sure.
Yes. Do you know where you are?
Oh, Med.
Yes, that's right. That's right.
He's alive, but heavy scalp bleeding.
What the hell happened?
He got shot in the abdomen and he's lost a lot of blood.
Baghdad.
No, we're going straight to the OR. Tell him we're on our way up.
Hang on, Daniel. Stay with me.
We're gonna take good care of you, Dr. Charles.
Stay with me, Daniel.
So it's been a few months. How you feeling overall?
You know, pretty good. Really pretty good. I mean, I get a little tired towards the end of the day, but...
You could have taken a little bit more time off.
I was going nuts.
How you doing emotionally?
Hey, who's the shrink here? I'm doing fine, thank you. Thank you for asking.
So you had some pain when I palpated your abdomen, so I'd like you to get a CT and a CBC with white count and make sure that you don't have an abscess.
I can't do it today. It's actually Jack Kellogg's trial, and I'm testifying. Oh, crap.
Boy, guy could have died. It would have made everybody's life a little easier, huh?
Please tell Robin that I'm truly sorry that I can't be there when you bring her home.
Yeah, sure.
Thank you, doctor.
Not a worry.
You'll still experience some symptoms of the encephalitis, but to a lesser and lesser degree.
What kind of symptoms?
The memory loss, phonemic paraphasia, substituting ken for pen, that kind of thing. You might also experience sleep issues, hypersomnia, impulsivity, disinhibition, irritability.
Sounds great, huh?
Look, nothing a vintage bottle of Clicquot can't fix, right?
Champagne? No, alcohol is definitely contraindicated. You'll still be on prednisone, ativangiodon, trileptal, labetalol, and you'll be receiving biweekly at-home immunoglobulin infusions.
Nice. Can I get some of that?
Thank you, Sarah. I get the picture.
Okay, I'll check in with you.
You know what would make me feel better than champagne?
come with you.
Yeah, sorry, we can't lock the door.
Well, we'll be home in a couple hours.
Yeah, but who wants to wait?
Yeah.
Hey, Sarah. Where you going? I got us some sliders.
Courthouse. I want to be there when Dr. Charles testifies.
Oh, right. I get it. Moral support.
Yeah, he's the reason I went into psychiatry. Dr. Charles taught me everything I know.
Yeah, it's kind of like your dad getting shot.
My dad, okay, my dad. I've not seen my dad since I was 6. There's no comparison between him and Dr. Charles.
Dr. Charles, can you identify the man who shot you the night of May 11th?
Yes, he's sitting right there. Jack Kellogg.
We're all very grateful you pulled through, Dr. Charles. There's certainly no one here would blame you for wanting to see Mr. Kellogg pay for the physical and emotional distress he's caused you. Now, just a few weeks before Mr. Kellogg shot you, he'd been a patient of yours, right?
Yes.
And at that time, his actions and his behavior warranted enough concern to place him on a 72-hour psychiatric hold for further observation.
That's right.
So you were aware that Mr. Kellogg was a severely troubled man?
Yes. Yes, I was.
The jury's already heard testimony from some other experts who claim that Mr. Kellogg's mental state does not meet the threshold of what would be considered legally insane. But they weren't able to evaluate him until well after the incident, correct?
That's correct.
And they weren't there in the moment when Mr. Kellogg shot you and then himself.
No, they were not.
Then would you say they're qualified to evaluate Mr. Kellogg?
No. In fact, I wouldn't. With all due respect to my colleagues, I feel that I am uniquely qualified to answer the question at hand, which is, what was Jack Kellogg's mental state at the time that he fired those bullets? And I believe that he was legally insane at that time.
So in your expert medical opinion?
I think that Jack Kellogg should be declared not guilty by reason of insanity.
Thank you, Dr. Charles.
Hey, why would you perjure yourself up there?
I didn't perjure myself.
You said that Jack Kellogg is legally insane. We both evaluated him, and we concurred that he was, and I quote, a malignant narcissist with overt sadistic impulses, toxic, yes, and a definite need of treatment, but not something that rises to the definition of legal insanity.
Sarah, I revised my diagnosis.
Why? And why didn't you tell me?
Because Mr. Kellogg began to present with definitive signs of dissociation and paranoia. In other words, after he shot me, it occurred we might have missed some underlying psychotic disorder.
You said he'd hid the gun in his pocket. Concealing it alone suggests an awareness of impropriety.
You want to know why I didn't tell you? It's because of this. You're emotional about the shooting, and why I very much appreciate the sentiment behind that, really I do. I also think it's affected your objectivity.
Objectivity? You think you're being objective?
Look, I gotta get back in there for Cross. You know you can help me? Go back to the hospital and treat patients, okay? I'll be back at the end of the day and we'll talk some more.
Arlo Littman, 20 years old, delusional and combative. Says he's radioactive.
You can't let anyone touch me. Make them stay away.
Negative on radiation poisoning. He hasn't vomited or been nauseated. Too agitated to get vitals restrained in the field.
You on something?
Oh, roommate says no. Doesn't do drugs.
No one touch me. No one touch me.
Karen, Paige, psych. All right, let's get him on the bed. Arlo, I'm Dr. Halstead. I'm gonna help you.
I'm death. Don't touch me.
Okay, let's get him on the bed. 1, 2, 3.
Get away from me. No.
Straight. Courtney on his left leg.
Yep.
You'll die. You all die.
All right.
All right. Yep.
Let's move him up a little bit. Spontaneous movement in all 4 limbs. Anyone disagree? Pupils equal, round, and reactive.
Don't touch me. Save yourself.
Hey. Easy, buddy.
Try and relax.
Yeah, I didn't sedate him. Didn't want to oversnow him. Thought you'd want to hear his spiel.
5-diazepam, 5-olanzapine.
Got it.
Hey, I'm Dr. Charles. I'm here to help you.
I'm dead.
Let's get him on the monitors. Tox, blood alcohol, CBC, and CMP. You want the restraints off?
Let's leave him on for now. See what his state of mind is when he wakes up.
All right. He's all yours.
Thanks, Will.
Yep.
Initial thoughts?
Schizophrenia usually manifests at his age.
Mm-hmm. Doris, could you give us a second, please?
Sure.
You okay?
Yes.
All right. Just making sure you're comfortable treating the patient.
Yeah, absolutely.
I'll be here if you need me.
Reese, when was the last time Robin had a full workup?
Just before she was released from rehab.
That was almost 2 months ago. How about a little follow-up with your patient?
She is not asymptomatic, but that's to be expected. Recovery does not happen overnight. It's a process.
So you reviewed her medication?
Yes.
With her neurologist?
And her internist and her pharmacist. I've been monitoring Robin very carefully.
Maybe somebody else should. Someone with more experience, maybe a little more familiarity with her condition.
If Robin wants to change physicians, that is her right, but that should be her request, not yours.
I'm bringing her in tomorrow. She's gonna get a full neuro workup, plus labs, plus scans. Understand?
Hi, Arlo. I'm Dr. Reese. I'm here to help you.
Please, don't touch me. He'll be contaminated.
Contaminated with what?
Radium.
How were you exposed to radium?
My professor, he works for the CIA. He put it in my food.
I see. Do you mind if I take a seat?
Just don't touch me.
All right.
Be careful.
Arlo, I appreciate your concern for me, but I understand the risk that I'm taking. I just want to help you, if you will let me.
My arms hurt.
I'm sorry. We can remove the restraints if you can stay calm. Can you do that?
Just don't touch me.
We will only touch the restraints.
I said be careful.
Okay.
Thank you.
Has he been agitated?
No.
Any need to put him back in restraints?
No.
Good, let's transfer him up to the psych ward.
Do you want to examine him before we do?
No, I'll check on him upstairs.
Okay.
Hey. Sarah, I got this patient in 6. Ataxia, clumsiness, general malaise. I can't find anything, and Abrams cleared him.
Do you want a psych consult?
The guy's convinced he's sick and wasn't happy when his labs came back normal. Adamant we keep testing.
Maybe factitious disorder, likes being in the hospital, doted on, needs people to believe he's sick.
Want to take a run at him? Otherwise, I got no reason to keep him.
Sure.
Thanks.
Mr. Janaszek, I'm Dr. Reese. I'd like to ask you a few questions.
What kind of doctor are you?
I am a psychiatrist.
A shrink? You think I'm crazy?
No, we just can't find a physical reason for the symptoms you're describing.
Which means you think I'm crazy or I'm making it up.
No, we just want to explore all the possibilities.
I don't believe you people. I'm a sick man. I come here looking for help and no one believes me. How many doctors do I have to go to?
Mr.
What do I have to do, huh?
Back away.
Huh? Why won't you help
Mr.
me?
Janaszek!
Sarah, what happened?
My eye! She sprayed me!
Oh my God.
Give me some water.
My eyes!
Sarah, you should go. Go! Janacek, just try to breathe normally, okay?
Dr. Charles isn't answering. Where are we on this, Dr. Choi?
We flushed Mr. Janacek's eyes. There's no sign of external injury. His vitals are stable. He's lucid.
And extremely pissed off. A doctor attacking a patient, really?
Go on, Dr. Choi.
Mr. Janacek hit the gurney when he fell, so we're ordering an abdominal CT to make sure there's no internal injuries.
Did he hit his head? Are you ordering a head scan?
There's no head injury. No indication of concussion.
Dr. Choi, this is CYA time. It's bad enough he sues us for the pepper spray if we miss something.
Order a pan scan.
Yes, ma'am.
Thank you, Dr. Choi. Dr. Stoll, Peter. Can you give me any explanation for your behavior?
I'm sorry.
Dr. Reese, you're suspended until further notice. I need your pass. Go home.
Secrets in their pockets.
20-something woman agitated and out of control. PD found her running around in the middle of the I-90 express lanes.
What's she on?
Nothing we can tell, no track marks or tweaking signs, but a lot of rambling.
Airway's clearly intact. Obviously has no problem moving forelimbs spontaneously. I'd say my job is done. She's all yours. Thank you.
Dr. Charles, treatment 3, can't wait.
Oh, man.
Go ahead, I've got Jane down.
Do a full assessment, and we will staff it later.
Thanks. You good?
I'm good.
Welcome back.
Don't open the box. No, open the box. No, don't open the box. Back and forth. The fingers you can count. The count likes to laugh, and he's just a puppet. Sometimes I feel like a puppet with someone operating me.
I'm Dr. Reese. Can you tell me your name?
On me, because surgery belongs in another part of the hospital. Each part separated by a floor made of marble or wood.
Can you tell me how you got here?
Cooking things through at a slow heat. The temperature cooks evenly through me to the core of my eyes and my brain, and none of it will stop. Watching the whirring, go, 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 go. Foot, left, right, back and forth, on and off, back and forth, on and off. The switch, the light switch, breaking.
Meds first, talk later. Please, let's get her risperidol, M-tab, 2 milligrams. Should calm her down.
All right.
So catch me up on Jane Doe.
No ID on her. Maggie is working with PD to get a name. Talk screen is clean. This isn't drug-induced. I'm thinking bipolar mania, rapid speech, psychomotor agitation, flight of ideas, plus she hasn't bathed in days.
So presumably she went manic and fled wherever she was living?
Mm-hmm.
You started her on Risperdal.
It hasn't made a dent. I want to double the dose and add a second mood stabilizer.
You ruled out all other possibilities. Schizoaffective disorder, temporal lobe epilepsy, delirium, other mood disorders.
Why? Mania can be diagnosed through pattern recognition, just like I've done, and there's been no clinical indication to keep digging for anything else.
Just humor me, okay, doctor? Look, it's your first day back. Before you add any other meds, just check all the boxes, even if you don't think it's necessary. Physical, neuro exam, motor function, head CT, all that stuff. Okay?
Okay.
Okay, good.
Oh, Dr. Charles. Our Jane Doe is Jamie Walker, an aspiring chef in culinary school.
Huh.
A month ago, she started staying up all night, reading the Bible and writing a manifesto. Last week, she dropped out of school and hasn't been seen home in 4 days. Now, my original findings, combined with her sudden onset drop, lack in functioning, her decreased need for sleep, her grandiose thinking combined with hyper-religiosity, it is what I thought, bipolar mania.
So exams, lab results, didn't poke any holes?
No, I never got to them. I filled in the blanks without a history.
Wait, so you got all that? A detailed chronological history from a patient in a manic state?
Well, no, it came from collateral I found and spoke with her sister, Melissa.
Dr. Reese, I thought that we were checking all the boxes. You know, doing it by the book?
I confirm my diagnosis. Doesn't matter how I got there.
Yes, When you're on probation, it does. It doesn't matter how you got there.
You're right. Okay.
So, so what's the next move for your patient?
I want to admit her to the psych ward. She hasn't responded to any of her meds.
And what meds would those be?
I doubled the Risperdal and added Depakote, also without filling you in.
Okay. Well, you know, with bipolar, all those meds should have made some kind of dent, so I'd like to take a look. Hi, I'm Dr. Charles.
4 days ago, we could have somewhat of a conversation, and now I don't know if she's eaten. Between her work and school, I thought Jamie was just stressed. I didn't realize she was having a breakdown.
None of this is on you. Jamie, I'd like to examine you now. Would that be all right?
Locked up inside. Wanted everything for it. Everything. So much my arms can't even hold them all. Flexing.
Clear, prominent disinhibition hasn't let up since my first exam, consistent with bipolar mania.
Let me go.
You see this?
Let me go. I'm not
In
enough.
her
Not
eyes?
enough if I gather
What?
today and all and
The
yesterday.
yellowish brown circles around her irises. I think they're Kaiser Fleischer rings.
Days and weeks flipping in the calendar. The bright light burns the trees, leaves falling. Stop falling. Too many people crowding. Too many people. Bright light burns the trees, leaves falling. Too many people. Too many people. Too many people.
Your sister is in culinary school. Has she ever said anything to you about copper, using copper pots?
Yeah, I think so. Something about them being the best heat conductors. I don't know anything about cooking. Does that mean something to you?
Dr. Reese?
Wilson's disease.
What's that?
It's a genetic disorder where copper accumulates in the body. Jamie's use of copper cookware could have accelerated the buildup that led to this manic episode.
If this is Wilson's disease, is there a cure?
No, but there is treatment to manage it, and she would get better.
Oh, thank God.
Dr. Reese, could I just have a word outside? Thank you.
Wiggle.
So, you couldn't even get close enough to your patient to examine her eyes?
She was so agitated.
Dr. Reese.
I did my 2-week suspension. I am in therapy. I am not supposed to be afraid anymore. I'm a psychiatrist. Rule number 1 is to connect with your patients, and I could not even look her in the eye.
Look, the good news is that you recognize the problem, right? Sarah, nobody learns how to master their fears in 2 weeks. Trust me, it just doesn't happen. Not even somebody as determined as you are.
Okay. You know, when Allison died today, I saw myself because she could not change. But I have to. I just don't know how. You have to help me, Dr. Charles.
Of course I will.
Okay.